Okay, welcome. It is Tuesday, November 17th, 2020. This is a special meeting / work session of the Thurston County Board of Health. My name is Ty Mentor. I'm Chair of the Board of Health for 2020. Also is Vice Chair Commissioner John Hutchings, Board of Health member Commissioner Gary Edwards. We have our County Manager Miro Chavez, our Assistant County Manager Robin Campbell, our County Health Officer Dr. Dimiana Abdulmalik, our Director of Public Health and Social Services, Shelley Slaughter, and Clerk of the Board of Health, Lydia Hodgkinson. And Ramiro, what other pieces of the administrative puzzle do you need to fill in?
Yeah, thank you, Commissioner. This is a board briefing. You have received public testimony last week. You'll have the opportunity to go through those comments you received last week. And this is a briefing in which you and your seatmates will have the opportunity to discuss the gist of those comments. This briefing is not open for public testimony, so let me announce that on the conference call. Good morning. For those members of the public who have joined us via conference call, just to let you know, you can follow up the conversation, but you will not be able to provide any public testimony this morning. So I will ask you to mute yourselves and follow on via conference call. Again, to clarify, this is not a public comment briefing. Thank you.
Okay, the first thing we're going to address, deferred from this morning's work session of the Board of County Commissioners, is the COVID-19 update. We do this weekly, but we're going to have it as part of today's work session, and then any issues that kind of relate to that we'll address up front before we get to the second item, which specifically relates to the state's Department of Health decision matrix for schools. So let's just start kind of as we do typically on a Tuesday morning with a COVID-19 update. I'm going to turn it to Shelley Slaughter, our Director of Public Health.
Good morning, Commissioners. So unfortunately, again, I have record highs of COVID cases to report across the state of Washington and Thurston County. As of the latest available data yesterday in Washington state, since the beginning of this pandemic, there have been 131,532 Washingtonians with COVID-19. 2,548 people have died in Washington state. Here in Thurston County, as of yesterday, we stand at 2,532 cases, with 389 of those cases being confirmed in the last week. Again, another record high for us. Unfortunately, we have lost 40 Thurston County residents to COVID-19. The latest this week was a male in his 50s. 158 people in Thurston County have been hospitalized, with 18 of those hospitalizations occurring in just the last week alone. Our current testing shows 5.3% of COVID-19 tests in Thurston County testing positive, which indicates high community transmission rates. There's an average of 502 tests a day. We've had 65,500 COVID-19 tests processed here in Thurston County. We continue to see high demands for testing. In terms of outbreaks, we've had 21 congregate care outbreaks since this pandemic began, 11 that we are currently investigating, and 2 occurring in the last week. We're starting to see our hospitalization capacity across the state and locally be stressed. Hospitalizations have dramatically increased. Our ICUs are beginning to show full status on many days. There are currently 30 patients, hospitalized in our local Thurston County hospitals. Not all of those are Thurston County residents. However, as our neighboring counties often transport their COVID-19 patients to Thurston County. Our hospitals, while are stretched thin, they currently do have adequate capacity and have made surge plans and are prepared to roll back on elective surgeries should that become necessary here in Thurston County. And with that, I will pass it to our health officer, Dr. Damiana Abdelmalik, to provide additional information and context.
Good morning, commissioners. We are in the midst of a significant surge here in Washington state. Today on the governor's risk assessment dashboard, our transmission rates have increased to 133 cases per 100,000 over the past 14 days and are projected to rise still higher in the coming days as our countywide data is confirmed by the state. Our test positivity rate has increased to 5.3% on the risk assessment dashboard, which is the highest it has been since the pandemic began. So the increase in positive tests that we're seeing really do reflect an increase in community transmission within our county. This week's case counts are 389, which is more than double the preceding week's total of 189 individuals who tested positive. This is a significant rise, and I am concerned that we may be on the path toward exponential growth of the disease if we all don't work together and bring down and if we don't all work together and do the things that we know that we need to do to stop the spread. So the governor, in response to these rising case counts around the state, issued a rollback with increased restrictions for 4 weeks, beginning Monday, last Monday, November 16th at midnight, and going until Monday, December 14th. This is a 2-week period or 2 incubation periods of the virus. The focus of these measures, while there are a lot of details and there are a number of services and facilities covered, and some for which current guidance has been left in place. Overall, the focus is to reduce the number of individuals in closed spaces essentially sharing airspace. So what that means is restaurants and bars are closed for indoor service, gyms, bowling alleys, indoor movie theaters, museums, libraries, and all of those sorts of and those facilities are closed with regard to their indoor spaces. Facilities that remain open include retail, personal and professional services, and religious services are asked to remain open in limited capacity, so 25% of indoor capacity limits. Schools, notably daycares, our courts all remain under current guidance in consultation, of course, with local health jurisdictions. I support these measures as a way to truly change the trajectory of disease in Thurston County. And as we go forward, we'll see what role these restrictions have in reducing our transmission rates and the burden of disease here. I'm asking each member of our community not to engage in indoor gatherings with non-household members, keep outdoor gatherings to a maximum of 5 people. And even when you're meeting with up to 5 people, make sure that you're wearing a mask and maintaining that 6 feet of distance. That's absolutely crucial. The safest way, I know we're coming up on the holidays, the safest way to celebrate the holidays this year is to celebrate with relatives, friends, and loved ones remotely. I know that I'll be doing that with my family and friends this year as well. Winter poses unique challenges with viral respiratory illnesses, and we often see a spike in respiratory viral illnesses at this time of year, even in non-COVID years. This is due to people being indoors, and the stability of viruses on objects at lower temperatures. I know that if we each do our part, avoiding indoor gatherings, maintaining a distance of 6 feet or more between ourselves and non-household members, wearing masks in public and when around non-household members, staying home when we're sick, getting tested as soon as we feel symptoms, staying home when we're instructed by public health to do so, covering our coughs and sneezes, and of course, washing and sanitizing our hands. I know that we can get through this challenge and come out the other side healthier and stronger. Thank you.
Okay, I'm going to ask at this point, since the next topic relates to the decision tree for in-person learning, I'm going to ask my seatmates if they have COVID questions for Dr. A or Shelley that don't relate to the schools, because we're going to get to that and we're going to hear some background on that. But in terms of all other questions you might have related to the report, Commissioner Edwards?
Of those that are sick, that have been diagnosed as sick, how many are really sick versus those that have it and maybe are asymptomatic or have very, very mild symptoms? I heard something on the news last night about a care facility maybe up north where 90 some people were tested positive, but 2, I think, needed to be hospitalized, and it was very minor for the rest of them. So I continue to wonder, we say that we've had 389 residents that have tested positive, but are those that finally went to the hospital the only ones that were sick, or were others suffering like flu-like symptoms, maybe smell and taste, that type of thing, but they did not need hospitalization? I'm trying to get a handle on the adverse effect this has on people and then weighing that against other things like other mental health and isolation. And so can you cover some of that for me? I know that's kind of a broad question, if you will, but I think it's applicable to what the public is concerned about.
Yeah, that's an excellent question. I know that when our case investigators speak with people, you're absolutely right. There's a small percentage of folks that are truly asymptomatic. Most people have some symptoms. And there is wide variation on people's experience of this disease, including even among young, healthy people. So it's hard to, while we know things at a population level, there are individuals who are young and healthy in our community that are persistently short of breath following COVID-19 infection. So getting winded walking short distances, persistent cough, persistent fatigue, being the 3 most common persistent symptoms in young people that aren't hospitalized nationwide, and based on what our case investigators are finding, that is also we're also finding that anecdotally within our county when we speak to people about their symptoms. The other piece is that when we see these spikes, we do see an increase in hospitalization. So more people getting COVID does result in more people becoming sick enough to require hospitalization from the disease, and we are seeing an increase in percentage of beds in our hospitals being occupied by COVID patients. So today we're just over 6%, and for most of the pandemic we were less than 5%, and we're continuing to see that rise because there's a lag between when people are first symptomatic and get tested for COVID-19 and when they may become sick enough to such that they require hospitalization. And you know, a lot of that, we've talked a lot about comorbidities, underlying conditions, and protected groups that require additional precautions. And all of those groups do see an increased burden of hospitalizations and deaths, which is what we would predict, looking at which is in keeping with our national data as well.
If you were to look at statistical information, I would guess that every year we know how many people die in our population, and realizing the population goes up. How many more have died than normal here in the state? And I don't know if we'd be able to tell for Thurston County, but at least the state must have that type of information, because a number of folks do die from the flu or pneumonia or whatever, you know, natural causes. So what's the difference we're seeing?
So you're exactly right. So that we are, so not at the county level, but excess death rate, which would include that just measures year on year excess number of deaths and excess death rate. But that would include folks that died as a result of delayed or compromised care due to the pandemic. You know, that also, you know, folks that have multiple reasons that are not specifically COVID related would also be included in that number. And I can find that number for you when it was at the last data snapshot where it was calculated, and I can send it to you.
Okay, I do think that could be beneficial in seeing what's the real impact that we're having here. The other thing, I know we're going to be talking about education in a different segment of this meeting, but you put out in your letter in the past, I think on November 8th, you're talking about outbreaks in workplaces, long-term care facilities, and educational settings. And I'm curious because in other areas that's contradicted in some of the reports. So do we have school settings that maybe haven't been referred to, including several instances in educational settings? So has that been a big problem? Because I know eventually we're going to be talking about the education component of this. I haven't heard anything about that. That's what I'm wondering about.
So we report, we report long-term care and congregate care facilities in terms of our outbreak reporting. There have been outbreaks in educational settings, both in Thurston County and around the state. That's definitely been an issue. I know that in any setting where people are congregating, once one person tests positive, it's absolutely essential to have robust case investigation and contact tracing. So when children and staff are in school, when they test positive, there's a lot of work behind the scenes to identify who may be at risk, what the plan is, or to keep a classroom or a group of staff or safe and to prevent transmission. But there have been instances of transmission in the educational setting here in Thurston County.
Okay, and just finally, how long are the results taking to get back to citizens now that are tested? What are we getting? A little faster return? Not so fast? What's happened there?
So we're still in the 24. We're still in the 48 to 72 hour realm for the most part. One of the things that we are noticing is that because labs have 24 hours to report to us, that patients are often getting their results first, up to a day before the results come to the public health department. And so we do a two-pronged approach in terms of our high-risk settings, in terms of both figuring out who might be at risk if anything needs to be done immediately, but the bulk of our work happens when we actually confirm a test with individuals. The other piece is that we are seeing increased lines and increased need for testing. And so that's another piece of it. Right now we're at the 48 to 72 hour mark, but we will be watching those times closely as demand increases.
Okay, I didn't want to take all the time, Chair.
Commissioner Hutchings, I'm going to move to you then. Thanks.
Thank you. I've got a few questions, but first I'm going to start off with a compliment to you, Director Shelley Slaughter. I'm going to presume when this hit us in March, I'm going to presume this was your very first pandemic, and you and Dr. Diana, you hit it hard. You hit the mark, and you put protocols in place. You put people in place, hired people. I mean, you just did a stand-up job, and I'm so admirable. I admire what you've done, and I perceive, because I don't know, but I perceive you've got a great working relationship with Dr. Ophthalmologist as well, and a great addition to the county. So thank you for taking all of our county citizens' interest to heart. Now, I've asked in the past, and I'll ask again, and you started to report it, I think, this last week, of the 389 cases that we've had this week, and you may not have this answer. How many of those let me back up, because this is kind of a question for you, Dr. A, but also for Commissioner E, Gary Edwards. Because you ask, well, of those that have had COVID, how many really have it? Or how many are really sick? And I've had the flu before, where I've been in the bed, I can't get out, you can't move, it's the flu. You can't stop stuff from coming out. But I've also had the flu where I'm functioning, but still the flu. I've had a cold, but I've had a cold where it's just nasty cold, but you're still a cold, and you're still contagious. So this is first for Gary. I don't understand that, what it means or what you're trying to get at or get to when you ask how many have COVID, really have it, and how many don't really have it, but they have it, but they're not really sick. I don't know what that means.
Let me follow up. Is that,
please?
can
Yeah,
I respond?
That's you. Yeah, that's to you.
What I'm really trying to figure out here is we're devastating our economy. Our young people, I'll just use suicide as an example. A lot of attempts in the school setting type thing, that age bracket. Where is the balance between any death is a tragedy, but if people are getting this and the majority of the folks are lightly affected as reported up north in that care setting where it said only 2 needed hospitalization. I don't know what the rest of them needed, but I think it's incumbent on the demographic that is in the threat community. I think they need to take extra care of themselves. They need to, if they're worried about grandkids coming over, they need to make sure that doesn't happen. They need to stay home. They need to be very careful. But I'm thinking that the rest of the society can continue to function, and I'm very worried that the school kids are really losing out on this whole thing. And so that's where my focus is. Can we get some common sense in here and I know there's going to be people sick, but just like you're talking about, Commissioner, where some days you're really sick if you've got the regular flu, and some days, well, you get by, you know. We don't want you to go to the store or go to work or anything like that. But I'm trying to assess a realistic approach to this. But yes, I want to get kids back in school because I haven't seen anywhere where that is a big threat category. Matter of fact, most of the private schools are functioning adequately with no problems whatsoever.
Okay.
So I'm trying to come up with a balance. That's where I'm going with that, sir. So.
Okay, thank you. That's helpful. And I see that and I agree that most at risk need extra protection perhaps, but I see that group has expanded because it used to be in the old days, back in March and April and May, oh, it's just the old people, everybody over 50, and then or 60, and then over 45, and now 40. Well, now I've even seen school-age kids. And so that demographic is spreading. So my question then to you, Shelley and Dr. A, is of the 389 cases we've had this last week, and I don't know if you have this data over the course of the pandemic, how many are school-age children? Say like 5 or 6 up to 17. Probably not fair to you to put you on the spot where a stat you might not have.
No, we do have that. It's just going to take me a minute to pull it up. But while I'm pulling it up, I did want to just mention that COVID-19 is a much more lethal disease, so causing death than other respiratory viral illnesses, and that our death rate, as calculated by the state on the Department of Health COVID-19 dashboard, is 1.8%, meaning that 1.8% of individuals in Thurston County who have tested positive have died as a result of the disease.
Right. Well, while you're looking that up, I agree with Commissioner Edwards when he says the kids are 100% of our future, but they're only 100% of our future if we can keep them alive. And I heard some research over on radio, news radio over the weekend, that kids that have had COVID are ending up with greater potential of long-term, not only physical health limitations or long-term health impacts, but also mental health impacts. And I didn't know if you've read any of that research. I haven't looked it up. Don't know if that's fact or fiction. So I'm not advocating open or closed schools. This is not about that. This is about advocating to keep people safe and not minimizing kids that get COVID, that, okay, it's nothing to them, they can recover, that they don't easily recover.
Yes, so we are learning more and more about that because there's an inflammatory component to some of the symptoms of COVID-19. So inflammation of the heart, inflammation, around the lungs and, lung capacity, among other, that loss of taste or smell is an effect that the virus has on our nervous system. And yes, we are seeing that folks who've had COVID are at increased risk or do have risk of a mental health diagnosis within the 90 days after being diagnosed with COVID-19. So that data has been coming out. Commissioner Hutchings, I do have the numbers as of yesterday that we have had 175 cases as of noon yesterday in children under 12 in the county since the pandemic began.
175 since March?
Yes.
Under the age of 12. Okay, thank you.
And 222 between the ages of 12 and 19.
Good grief.
Yeah.
That shocked me. I didn't think it was that high. That's really surprising. Thank you for that. And have you heard or have you read anything regarding mental health, kids with mental health issues being exacerbated if they've had COVID?
So I haven't read anything specifically about children with regard to COVID-related mental health issues at this time. Of course, I'm always scanning the literature because so much of the decisions we make today, even those long-term even the long-term impacts of a viral illness that might not, in the face of a pandemic where we're seeing hospitalizations, deaths, shutdowns of our economy, might seem small. We are not sure what those are going to look like over time. And so I of course am monitoring the CDC reporting as far as like actual studies, as well as other sources as they come up. But yes, that's a concern of mine as well.
Thank you. Well, I know there's two things that I think we can agree on, perhaps, and that is COVID-19 is very real and it's very contagious. And so I understand that there's, I don't say conflict like there's a fight, but there's a dynamic tension between superintendents and principals, among principals, among teachers and principals, among teachers themselves, and even paraeducators, and then even the representative groups, their unions. Do we go back? Do we not go back? Yeah, we want to. We don't want to. And it's like I said, it's a very dynamic tension, and it's in real time. So now that's all the questions I have about COVID, Mr. Chair. I'm anxious to hear about the decision tree and such, knowing again this is very real and it's highly contagious.
Mr. Ty, could I ask a question to the doctor on a statement she made?
Sure.
You mentioned, doctor, 1.8% of those tested. And I still don't get it why we don't utilize that matrix against the total population of 7.5 million people, I think. And if you do it that way, the chances of getting this and dying are like 0.02%, or, I mean, it's just such a slight number, it's almost non-existent. Although if you get this and you end up dying, it's the most serious thing ever happened, or if your loved one gets it. But I'm trying to come up with a balance. And why do we just go with those tested end up in that situation? Why is it that we can't say out of the general population? Are you afraid the public will just disregard it if we tell them the truth? Is that, and I guess your truth and my truth looks like there's a conflict there at this point in time.
It should be only one truth, by the way.
Yeah, well, that's true, but I really think if we use the general population, we're better off.
So the issue there, Commissioner, and you raise a very important point in terms of risk communication, is that one of the major reasons why we haven't seen significant cases of COVID-19 across the state is because of all of the mitigation measures that are in place. So a huge part of why that number is so tiny when you do it by percentage of population is because we're distancing, we're masking, we're closely monitoring our facilities, our learning facilities, our correctional facilities. We've changed our way of life to prevent spread. And so the reason why the case fatality rate is so important is looking at the folks that still got sick, even after we did all of these things, how lethal, what is their risk of death? And then you can think about if we didn't have those mitigation measures and spread of COVID-19 was allowed to spread without check in our community, then you would see the rate of deaths significantly rise. And that number that looks small against a population of more than 7 million wouldn't look so small. And you would be seeing deaths not just directly from COVID, but you would be seeing deaths related to hospital surge, people not being able to access care. There's mental health effects associated with with, of course, getting COVID, even when people, even for survivors, but then there's also the family and loved ones who lose somebody and those effects. So when you're looking at mortality, we're using a case fatality metric, which, albeit, and you raise the point, doesn't accommodate asymptomatic cases who may not be getting tested, but that's a small fragment of our population compared to the total population of the state. So what I suspect is that if we get the opportunity, and I hope we do, to go back and do some population-based data to try to identify what that asymptomatic group is, I suspect we may have a more I suspect that we'll have to adjust our death rate or our case fatality rate across a broader group once we kind of account for asymptomatic folks. But that number is still just a very, very small portion of our population because of all of the mitigation measures that are in place, and because of the way our community has really come together to do their best to stop the spread of this disease.
Okay, thank you.
So I would also just like to add one thing. Back in February, when I came to brief the board on COVID-19, Washington State had the very first case of COVID in the entire nation. This virus is novel. It's very new to us. We've only been doing this for 9 months. And since that time, in a very short period of time, COVID-19 is now the third leading cause of death in the United States, just behind cancer and heart disease. So this is a huge concern. It is, as Dr. Abdelmalek stated, much deadlier than the flu and many other diseases that we work so hard to prevent in public health.
Commissioner Hutchings, you're muted. I see your hand.
Yeah, may I add one more question or comment? One of the metric that you keep referring to also, and we ask about, is the bed capacity in the hospitals. And if I were this time last year, if I were to ask you, is America's health system getting ready to fail? You would have laughed in my face and said, wow, where's he coming from? So my concern is, and when I hear major hospitals in metropolitan America that are at capacity and they're shipping folks out, do we still, I'm not talking about Thurston County or just even Washington State, but are we really pushing the envelope now for our health system to go bust because we don't have the room for enough COVID people in addition to the other folks that need hospitalization? How close are we to that edge?
So that's a dynamic conversation that we're having with our colleagues at our local hospitals. We meet with them. We're following, of course, our hospital data, and we're also meeting, at even at the state level to look at markers. I know that I'm working with our colleagues in our local hospitals to help facilitate surge capacity where there's health officer input that can help, so that if we need that extra surge capacity, that we've got systems and processes in place, and that we are supportive of all of the work that's currently being done as we look at this, what's been for us over the past 2 weeks an exponential increase in cases. So we're not there yet, but hospitalizations lag cases by more than a week. So we're looking down the road.
Okay, thank you.
Okay, thanks. Ramiro?
If you can, thank you. As commissioners, you move into, as the Board of Health and additional conversations related to this, I'd like to, uh, pay attention to a couple of words that you have heard over the last few months. And this community transmission and community spread. And that has been a constant message through the whole pandemic. And I believe the obligation that Dr. Abdelmalik, Shelley, and you as a Board of Health, the obligation that you have is to reduce or eliminate community transmission and community spread of this deadly disease. And I believe we can probably see any issue from different perspectives. But the fact of the matter is we continue to see increases in cases, not just in Thurston County or the state and the nation, it's around the world that we see how deadly this disease is. I'd just like you to keep that always in mind, what the obligation I believe that you have as a Board of Health and the obligation that Dr. Abdelmalik and Shirley and all of us have is to reduce and prevent community transmission and community spread, not just this disease, any other diseases that we manage across the county. And that continues to be the main objective. So as you move along to these conversations, please keep that in mind, what I believe is your obligation and your objective.
Okay, thank you. So I have a few questions. Some of them were covered. I won't cover hospitals because I think we covered that. That was on my list. I'm not going to ask about long-term impact because Commissioner Hutchings asked about that. I would just make the comment that I do understand Commissioner Edwards' thought process about the balance, but for me, the balance isn't just the symptoms that are experienced, during the initial, diagnosis of being COVID positive, but it's that plus long-term effects. And that's a big X factor to my understanding. We don't know exactly all the ins and outs of what, and what I read in August is that there were long-term effects that were going to affect young people. So I think that that's just a big X factor that makes me very cautious about just sort of balancing. It's not just about the current symptoms. We have an X factor we have to factor in. So that leaves me with two questions. One is about testing. We've read in the newspaper about the recent kind of lines, I guess, in Hawks Prairie in particular. I took a call yesterday from a Lacey council member who was describing, and this was brought out at Thurston Thrives, I believe, meeting, that the Lacey folks have identified, and maybe it's in I assume it's within coordination with Shelley's team, to identify a place. I think they said it was on Pacific Avenue, to maybe use one of our mobile facilities to add some additional testing capacity within the center of Lacey. We've got a lot of seniors around Panorama, and even getting out to Hawks Prairie is kind of difficult for some of the Lacey elderly folks, and trying to alleviate. I know we've got those units out in Rochester, Tenino, et cetera, but I guess I wanted to hear more about that. Like how many hours are going to be? Is it just a pilot or a test? Or are we going to try to expand hours in that location? Or what's kind of the plan for that mobile testing and kind of adding capacity there in the heart of Lacey?
Our community-based testing team is working with multiple community partners throughout Thurston County to identify new sites and places where we can increase access to testing via our mobile public health testing. So I know someone from the city of Lacey reached out to us to offer a site, and we're working with them as well as many others in the community. And I will say to anyone who may be listening to this, if someone is interested in hosting a community-based testing site, our public health mobile team can come and provide free testing to anyone. So we do partner with Providence to operate the drive-through testing site, and like you stated, Commissioner Menzer, and has been publicized in the media, the lines are extremely long. We're trying to preserve our drive-through testing for those that need it most, that find it difficult to access testing in any other way, as a means to keep pressure off our emergency departments and our waiting rooms and urgent cares. But we have many community-based testing locations available, and we're constantly working on that. We continue to plan to expand it, and anyone can go to our website and see the schedule, and there's contact information for anyone who would like to host it. And we're very, very happy and grateful to all of our partners who are willing to do that, including the city of Lacey.
Thank you. Yeah, my thought, just hearing that, was that if you look at the map and the population centers, I mean, that identified location, which I think was across from Skipper's on Pacific Avenue, seems like it's pretty ideally located for giving the most people a lot of access. So I would give a thumbs up to expanding there. My other question was about the positivity rate. So the report we have says 4.6. I think Dr. A said 5.3. I'm not sure what the difference is there. And then my follow-up is, how does that compare to, like, what's the window across the nation? Like, South Dakota's raging and New York, like how would that number compare to where you'd see, other hotspots across the nation? How great does this, like in Thurston County, we've heard this vary from 1.4, and now we're up to, looks like 5.3. Like, how high can this go, or where does that put us in relation to the hotspots across the country, that positivity rate?
So that's a bit of a tricky question. To answer the first question, the 5.3, because our reports are prepared in advance, the 4.6 was cumulative for the week. The 5.3% is what's on the governor's risk assessment dashboard right now, as of this morning. So that's the difference for that number. As far as hotspots, some hotspots are seeing greater than 10% positivity rates, but really what that percent positivity rate tells us is two things. One is the increase in cases that we're seeing due to just an increase in testing, or is it an increase in community transmission? And this is definitely an increase in community transmission, because there's fairly robust testing, and we're still seeing that increase in the number that are positive. And the flip side of that is thinking about access to testing. And so this means, if thinking about the folks that look at that Hawks Prairie line and say, maybe I'll put this off, maybe I'll see if this goes away, and either present later or don't present for testing. So that's the other. So thinking about access within our community to COVID-19 testing. And so what we're seeing is that in terms of folks that may need it, there is room for us to expand our testing capacity as well. And I know that this is occurring across our state and across the country in terms of this tension.
Okay, thank you. And I'd like to move to the second agenda item, which is the Washington State Department of Health Decision Matrix. And this relates specifically to provision of in-person learning during this pandemic. I don't know if Shelley or Dr. A is going to kick off with this, but I think we should move. It's 11:20. We have 40 minutes to go. Let's move to that topic.
Okay, can all of you see my screen?
Yeah.
Yes.
Okay. And you're all looking at the decision tree?
Yes, Doctor, you may want to zoom the screen so just for the viewing public, they can see a little bit better.
Sure, thanks. So I'm going to really kind of focus on where we are. So I wanted to start with a little bit of background. So we are well above the high transmission threshold of 75 cases per 100,000 over 14 days. And on the governor's risk assessment dashboard, we crossed that threshold on October 23rd. At that point, So when I saw our trajectory headed upward towards, towards the high transmission zone, I spoke to our superintendents and wrote a letter letting them know that that's where cases were going within our county. When we crossed the threshold, I wrote a second letter stating that I would be looking at whether we maintained our position above that threshold over an incubation period of the virus or 14 days. And that if we had consistent high transmission over an incubation period, then in alignment with the State Department of Health's decision tree, I would be making recommendations for in-person remote learning, with the exception of in-person learning opportunities for small groups who are cohorted of students based on the highest need in groups of 6. We met that criteria on November 6th. And at that time, I issued another letter, which informed our superintendents and heads of school as to where we were with regard to COVID-19 transmission in our county, and that I strongly recommended and continue to recommend the transition to remote learning, giving a grace period of 2 weeks for those who had some hybrid learning in process. This guidance is in agreement with the decision tree, which recommends distance learning with limited in-person learning and small groups or cohorts, prioritizing students with the highest needs. The state, like I, gives schools and districts the ability to determine within their specific communities who best would best benefit from that cohorted small group learning environment. So including students with disabilities, students who are homeless, students furthest from educational justice, and young learners. But I deliberately recommended more the cohorts in terms of size based on need, while allowing each superintendent to look at what their community uniquely needed, and so that they were able to tailor those interventions to best meet the needs of the communities that they serve. I also recommended, so guidance at around that time also came regarding sports and high transmission rates for groups of 6. And I have recommended that as well. A lot of the essential piece of keeping our students safe is our ability to quickly identify who's sick, get them isolated, engage in robust contact tracing to figure out who might be at risk, and then make the big decisions of how to keep students and everyone who works and learns in our schools safe, especially in the setting of this increased transmission rate. We have been working with our superintendents on a communication plan that gets updated as more information is known and as the guidance changes. We are in close communication with all of our districts when positive cases occur. So that's one of the ways that we're helping prevent spread of COVID-19, even amongst these small groups. Additionally, there's our schools, have processes in place to mitigate spread, including masking, distancing, cohorts, and all of those critical mitigation measures that have the biggest effect on keeping schools safe of any intervention. And this was confirmed, or this is supported also by the IDM report that really speaks to the absolute importance of mitigation measures and preventing spread in our schools. We are in a phase of exponential growth of COVID-19, and in keeping our learners and those who work to help facilitate learning within our community safe, this approach of focusing on mitigating spread within small groups, on maintaining good communication pathways to address challenges as they come up, has been a lot of my focus in the past few months. And I'm happy to, and this is how I, as health officer, I'm trying to balance the needs of the students in our community with the needs of their families and the needs of all of the folks that are working together to help facilitate learning. Thank you.
I think there's going to be a lot of questions. So what I'm going to suggest is that we kind of go maybe one each, just go kind of round and round. That way, if we don't run out of time, everybody's got an equal shot. And this time I'll start with Commissioner Hutchings, and then we'll go to Commissioner Edwards.
Thank you, Ty. Hey, Doc, real simply, this document we're referring to, or you're referring to, is the Washington State Department of Health put this out in October. And it's very comprehensive. And I just want to know, can we get this, or is this on the county's website? Because I want to draw people's attention. Not only is this comprehensive to look at and understand, but there's a footnote on page 2 from the Kaiser Family Foundation with a research paper titled, "What Do We Know About Children and Coronavirus Transmission?" And I haven't read it. I just saw it now, but it's something I will read. So is this a document we can put on our county website so people have access to the footnotes, the websites being referenced, and they can soak this in?
Yes, I'm happy to make sure that that's on our website.
Thank you, and thank you, Shelley, for that. And that's all I have, Ty. Thank you.
Okay, go ahead, Gary. Take a question. Take a shot.
For the problems that supposedly education is having or might have, how do you square this business about private schools are not having a problem and other counties that have chosen to push forward with having kids in school do not seem to be having problems either? So are we keeping track of those other jurisdictions? I've got a folder here with quite a few that close by, far away, Lewis County, Spokane. I guess Enumclaw is not aligned with whatever King County is doing, and having no problem. So how do you square the matrix that you've been talking about with the reality of these private schools that have not had any problem and public ones that have moved forward and don't seem to be having a problem either? Are you keeping track of that type of thing, and do you weigh that in?
What I will say is that I am personally informed of any case that occurs in any school, public or private. We do not comment on specific cases. So I'm definitely well aware of the challenges being faced by our educational community in both private and public and daycare settings, for that matter.
I guess I'm curious about your comment that you don't comment on certain things. Why is that? Aren't we trying to get all the information out?
So the information that's absolutely, so if the reason why we are, as public health, our goal is to mitigate the spread of disease within the community and to keep our community as healthy as possible. Of course, the pandemic has posed a significant challenge to that. Part of that has to do with, especially in a disease like COVID-19 that does carry stigma, both for those who've had it at times, as well as facilities in which one or more cases have occurred. We need to protect we protect the privacy of our citizens unless it's a matter that affects the health of the public. And that's the basis for that really is the basis for us, for myself, not commenting on specific cases, is to protect the privacy of those suffering from COVID-19 and to protect and to facilitate our ability to engage with members of the public so that they can come to us without fear and know that regardless of if they're following the guidance and my recommendations or not, we should be their first call to help prevent spread in their facility and to help keep their specific communities safe.
But can't we lump together all those private schools and other government entities that are doing things differently? We don't have to talk about them separately, but are you aware of particular problems that, no, that's not working, that's not true, we've had all kinds of outbreaks, and I'm not hearing that. So I'm trying to figure out why we don't look to what's going on and utilizing that as part of this matrix. That's all. So that's it, sir. I'll let up on you guys for a minute. But I would like to hear the doctor respond to that.
Yeah, I will take your I understand the question with regard to reporting. I will take that under advisement in terms of both communicating to the public, like what our risks are and where they are in a way that doesn't increase stigma and truly promotes the health of our community. So in terms of where we're seeing problems, a lot of it really stems from close contact, which happens, in daycares and in specific educational settings. It can be between staff, it can be between students and staff. And as more cohorts, and as we've seen with cohorts, including groups that require busing, we're closely watching the transportation element as well. So there are a lot of different factors and moving pieces that account for some of the risks that we're seeing, and the risks that we're seeing are not unlike risks that we see whenever people are in congregate settings or are, or have prolonged periods where they are close to somebody who may be infected.
Okay, I got a question for you.
Commissioner,
Some of the comments.
give me a minute on the conference call.
Okay.
For those joining us via conference call, please mute your phones. We have a background music going. Please mute your phones. If not, I will have to close the conference call. Please mute your phones. Unfortunately, that is not going through, so I'm going to have to close the, and anybody who wants to follow up, we have this on YouTube and is recorded, and anybody can catch up with additional information. So unfortunately, I have to close the conference call because we have a lot of noise feedback. Thank you. All right, sorry.
Okay, my question was related to some of the public comment we got last week. A few of the testifying citizens talked about they were concerned about the kids, and they said, we need to throw out the metric. Like, if they understood that you were following metrics, but they thought that the harm was too great and that we needed to throw out those metrics or use different metrics. And so I guess my follow-up question to that is, the metrics are right here on your screen, greater than 75 case over 100,000, put you in a high category. And so I'm wondering about the metrics, and are they out of line with metrics that are being used? I mean, how tailored are they to Washington versus is the CDC recommending, and this is just kind of in line with the country, or what would be I guess what I'm driving at is, how big of a decision would it be to follow the advice of those citizens and throw these metrics out, or double them, or make them more permissive? I mean, how out of line would that be with guidelines that you get from other places? And that's the rest of my question.
So what I will say, yeah, that's an excellent question. So this was a Washington specific decision tree that was made for our local context, based on what was known at that point. In terms of the CDC, the CDC has guidance with multiple working parts, and there is but there's always that emphasis on coming back to local context, where you see it in this decision tree in terms of trends in cases and hospitalizations, in terms of test positivity. I do know that that this is a conversation that we're having, and that's being had in multiple states across the country and within our state, in terms of looking at what the Washington state specific experience has been, and what if any adjustments to these metrics can occur to promote learning. So that's a conversation, and that's currently occurring kind of at that state level. I know that other states like Oregon has shifted to a different model, and this is definitely a fluid situation. As we get more data, more guidance, my recommendations will of course change to reflect the best available data and guidance that pertains to both our state and our county specifically.
Okay, so just to kind of put a bow on that, it sounds like the numbers we have are the best that we have for now, but the state is probably hearing concerns of the citizens and looking at further data, and there could be adjustments to these metrics if they find that to be warranted.
Yeah, that's correct.
Okay. I'll go back to Commissioner Hutchings. Do you have another question on this topic?
I do, and I don't know if it's an appropriate question for you to answer. I know you don't represent the state, you don't represent the schools, you don't represent the Office of Superintendent, but what advice or direction is the state superintendent of schools giving to the schools in regard to COVID opening and not close, and you know what I mean, all the different things? Are they leaving it up? Is Mr. Reckdahl leaving it up to the individual school districts? Is there guidance out there that he's giving?
So there is overall OSPI guidance on the schools that has been published and out.
Okay.
I know that each district in each county is really different, and I haven't seen a blanket change across all districts and counties in the state at this time, in terms of guidance from
The OSPI.
from OSPI.
So OSPI hasn't changed to up or down. They just kept it kind of the same then over the last several months.
So right now, the overarching guidance for the state is is in keeping with with the current published guidance. There may be instances where, you know, specific issues where OSPI is weighed in, not within our county, but nothing across the board.
Okay, thank you. That's all, Ty.
Commissioner Edwards.
May I add
Oh
something?
yeah, Shelley, go ahead.
Sure. Of course, we don't speak for the Office of Superintendent of Public Instruction, but I will say that local health jurisdictions have worked closely along with Washington State Department of Health and OSPI to work together and collaborate on the current metrics as well as the future metrics that Dr. A mentioned. And I would say across the board, just for anyone who is wondering where we all stand on this, everyone is 100% committed to getting our kids back to school safely. And so there are a lot of collaborative efforts happening now and that have been happening for us to find a safe way to get especially our youngest learners back in school as soon as possible in the new year. So we're working towards that. And I just wanted to share that.
Thank you. I just want people to understand there's the state OSPI, the State Department of Health that comes down local, then there's the Department of Health and our Thurston County Health Officer, but the Board of Health don't decide go back to school or open schools or not. We don't decide that. Thank you, sir. Thank you.
Thank you, Commissioner Hutchings. That was kind of something I wanted to make sure that got brought out before the meeting ended. And I didn't really understand your initial question as hitting that, but you summed it up. That yeah, I think it's important that folks understand, and we monitor these things and we want to hear the public testimony. I'm not discouraging anyone from coming to talk to us about it, but ultimately the Board of County Commissioners doesn't close schools, open schools. It's a little more complex than that, and the school administrators have a role, and Dr. Abdulmalik has a role, and the state has a role. We probably have less of a role than each of those three levels. But, anyway, I'm going to go to Commissioner Edwards for another question.
Doctor, I think you mentioned that you maybe haven't read a lot of literature on mental health issues with young kids. Maybe I don't have that right, but are you at least staying in touch with that community that would be able to advise you on the detrimental effect that this is having on our young population?
So I do have a lot of direct contact with, you know, our school nurses as we work on this. I do receive calls and emails from some of our pediatricians, and I'm looking forward to meeting with them to further share information and get more boots on the ground. Information. I am consistently trolling the literature for good, high quality studies and data. So that's the critical piece as well, especially with regard to mental health. In our young people, those studies are hard to come by, and I mean robust studies. But I am always looking and always open to that. We are seeing stress from the pandemic across our entire community, not just our kids. So that's definitely both amongst those who have been personally affected by COVID-19 due to themselves being infected, and that data just came out recently as well. As well as folks impacted by by the stress of, loved ones becoming ill, or the economic stress, or any one of a number of other stresses. So while our students are, while our students are impacted and our parents are impacted, our whole community is also impacted. There are mental health resources available on our website, but I am I'm looking forward to both working with our community to guide all of us through this pandemic as safely as we can, while acknowledging the significant toll that this has taken on so many members of our community from all walks of life, from children all the way through grandparents and great grandparents.
Oftentimes we hear that you don't want grandma and grandpa getting this, don't want to take it from school back to grandma and grandpa. But in so many cases, I think grandma and grandpa are probably doing their best to actually supervise these kids in school while the parents are out trying to make a living. So I'm not sure that's valid either. I guess what I'm looking for as we wind down here, I am really looking for balance on what's best for the kids, best for the families, best for our economy. And I know that bailiwick doesn't all fall on you. I realize that. But as we move forward, I really think the detrimental effect this is having on our young people might outweigh any potential problem that we as a society are going to receive from this by not opening up. So I'm hoping that you'll compare some of those statistics involving those public schools that are opening up and seem to not be having a problem, and also the private schools that seem to not be having a problem by opening up. So, thank you.
Okay, I think it's my turn. I had a kind of a question about, so if schools were to open, I know one of the things would be getting kids to school, and whether buses could operate safely. And that's just kind of plays into the whole picture. And I was just wondering if there's been any lessons learned from public transit, either locally with the intercity transit or regionally. Learned anything about public transit and the safety measures there, and how effective they are, and how that might play into our thinking on the buses and schools. I'm just curious about that. I sit on the IT board, and I really haven't heard anything, but you guys are, you're down in the weeds of that more than I would be. So I'm just curious.
Right, at this point, so there has been data about, but the problem, with a lot of this data, and that's why I'm always talking about, good data. All data is good, but making sure that we're measuring the right things and coming to appropriate conclusions. I know that I've seen data that folks that ride public transit, but this isn't Thurston County specific, so I can't speak to intercity transit specifically, or our school buses. But as we can see with the governor's new restrictions, that shared airspace does have some risk. I know that in our county, our schools are working really hard to maintain at least 6 feet, windows open on the bus to promote ventilation where possible, as far as school busing is concerned. And it's a situation that I'm watching really closely, and that's part of why the movement in terms of increasing in-person learning opportunities has to be done so carefully, because there are so many moving parts. And as we go forward, I'm assessing our Thurston County specific risk with the protocols that our districts and our schools specifically have in place. But in terms of cases where people have directly, linked it to like intercity transit or a school bus, we're still monitoring that situation.
Yeah, I can't remember if I heard it on TV or in a meeting locally, but I know they were talking about the data and, the fact that if you're getting it from a casual contact, you're just not going to, that's a hole in the data. You're not going to, because if somebody asks me, like, for my close contacts, I'm not going to think of, let's say I ride the bus, I'm not going to be able to name, the people that I rode on the intercity transit bus with, or I'm not going to be able to name who was in the restaurant. I think I saw this on TV. They're talking about how it's, it's difficult to, um, to the extent that we've learned that this shared airspace can be a problem, that really kind of creates difficulties for super accurate contact tracing. That's where that phone app might be able to be really useful if the public starts using it in a widespread fashion, because that could identify folks, that I sat right behind on the IT bus. I wouldn't be able to give that person's name to the contact tracer, but the system might be able to identify and reach out to that person and advise them to get a test. So anyway, it's just something interesting. Okay, we've got 8 minutes. So, and I think we've all asked an equal amount of questions. I guess I would ask for a final quick question or comment or anything that the board would like to follow up and use these last 10 minutes on. Commissioner Hutchings, do you have anything?
No, sir, I don't. Thank you.
Commissioner Edwards, any parting shot?
Yes, I guess my parting shot would be the wellness of kids and considering everything that they're up against. I know we're worried what's the long-term effect should they come down with this, but I don't know. I really think we're all going to get this at some point in time and learn to live with it to a degree. I know that they're coming out with treatment and being able to give us some shots here before long, but I would hope that we can get kids back in school as quickly as possible, and we'd use successful examples as part of our matrix.
Thank you. I guess my last comment I wanted to make was just kind of speaking to, we don't get to directly respond to public comment, but I just would like folks to understand, we heard a lot of very articulate and passionate citizens who obviously care a ton about their kids. I mean, I sit up there with a wife who's a kindergarten teacher in Olympia School District, a son who's a freshman at Capitol High School, and a daughter who's a middle schooler at Marshall Middle School. And so this is front and center in my family every day. And so I take this very seriously. Um, Again, it's not exactly our decision to make, but two of the things I am concerned about are the long-term health effects on kids, and I am concerned about the hospitalization issue, because if we don't, we have a vaccine hopefully around the corner, and if we don't take measures to make sure we don't exceed if we exceed hospital capacity, and I'm hearing reports that this is happening in other countries, not even being reported accurately, but then you really do, then you really are accelerating people's, fatality unnecessarily. So we have to be very mindful of that. Number one. Number two, we have to think about the long-term effects on kids. And it's not just the kids. I mean, the whole school apparatus. We have teachers. Who are, as I think Commissioner Hutchings alluded to, are very different. There's a lot of difference of opinion. I can tell you from my wife who reports to me and there's difference of opinion among older teachers, older staff, older parent educators about their safety and safety of of the environment. So it's just a very difficult issue, and I'm glad the folks came in to share their point of view. The board will always consider that very carefully. And Dr. A and Shelley, we have 5 minutes. Any last thing you would like to say to respond to what you heard last week or to the board's questions before
Before they jump in, I was just notified by Megan Porter, our PIO, that this decision tree, which is attached to this paper from the State Department of Health, along with the websites referencing research articles, is now prominently displayed on our county's COVID site. So folks at home can see that and pull it and print it and chew it up. Thank you.
I'll go to Dr. A and/or Shelley, and then Ramiro had something final.
Well, It is always a pleasure to speak with all of you commissioners, and it's always so important to hear the perspectives and all of the challenges being faced by folks in our community. So I very much appreciated the public comment. I am continuing, to take the health of everyone in our county, from the very young to the very old, all 291 plus thousand of us, into account in giving the best guidance that I can, based on what we know and the data we have, and what we can, and how, and the specific context of our county. And we will get to a place of more in-person learning. I want to make sure that it's done in a way that's safe, both for everyone that learns in our schools and everyone who works in our schools as well. Thank you.
And I would just like to add how much we appreciate hearing all of the perspectives from families, from kids themselves, from the teachers, our superintendents, providers in the community. We greatly appreciate all of the perspectives. We take that into account in public health. We are always trying to balance the social, emotional, and physical health and well-being of everyone in our community. And while it isn't safe currently to expand in-person learning with high transmission rates, with the new restrictions in place, this is our chance as a community to do everything that we can during these next 4 weeks so that we can get to having it be safe for kids to return to school again. So we are focused on that. That is our goal. I myself am a parent as well. I have a 4th grader. I so empathize with all the parents who shared their struggles, and we know that this is taking a toll on our entire community, and we're doing everything we can to keep our community safe. And I know that things will get better, and thank you everyone for your sacrifices now. And a special one final thanks. Our schools, our superintendents, all the staff, teachers, bus drivers, everyone are working so hard every single day to provide for education for our kids and make plans for that return. It is a really thankless and hard job that's happening behind the scenes, and we really have appreciated the collaboration that we have with them. Thank you.
Ty, could I just say one real quick thing here? I'd like to have everybody remember that should we return to in-person learning at some degree, it's going to be voluntary. If you're a parent you're worried about your kid, you don't want your child to be in school because of whatever, or if you're a teacher and you don't feel safe going back into the school, you can continue to conduct your teaching through the net, and the child can do that as well. So it's all voluntary. And I think that's a big key to this. It's not a mandatory thing we're asking for.
So connecting Commissioner Edwards' comment to Shelley's comment, because I see it in my household, I think what Commissioner Edwards just said is true, but I want folks to think about the tremendous burden that's putting on our school system to both do a hybrid system, an in-person learning system, a completely virtual system. My wife is just scrambling around. I mean, in the last month where we were almost about to go to a hybrid system, the schools were, she is on, the school personnel are working day and night to try to manage the right approach for the kids. And she does do in-person learning for some of her key kindergarten students that need it. So that is happening. I want to thank Shelley for those reminders, those community reminders. I altered my Thanksgiving plans over the weekend, and it wasn't a very happy thing to do for my mom who's in Vancouver and wanted to see my kids, but that's just the reality of where we're at. So I appreciate the community stepping up and making those adjustments for everybody's sake. Ramiro, you wanted to wrap this up, please do.
Yeah, thank you. And through this discussion, and this has been a difficult virus pandemic to deal with. You asked of Shelley early at the beginning of the meeting if this was her first pandemic. I know it was a tongue in cheek, but the point that I want to make is what we knew about this disease 4 months ago is no longer applicable. What we knew a month ago perhaps is no longer applicable. We continue to learn. We continue to see new data. We continue to react to everything that comes before us because we haven't done it in the past. And I'd just like to clarify, and I think the board members already mentioned this, in the role of the Board of County Commissioners as well as the Board of Health. The Board of Health and the Board of County Commissioners do not they have authority to open and close schools. The Board of Health also, with all due respect, is not in the position to dictate how a professional public health opinion, Dr. Abdel Malik, has to put in place. She is the professional. You hire her to guide us through this pandemic, and that she's doing to the best of her abilities. You heard that, and again, I'd like to continue to stress the fact, community transmission and community spread. And that is the main objective of all of us, to minimize or prevent community transmission and community spread. As Dr. Malik stated, there's over 290,000 individuals who reside in Thurston County. And at some point, we need to strike a balance as to how we can protect our community from this disease. So that's what I had to say.
That's a good close. Our Board of Health meeting for November 17th is hereby adjourned. Thanks everybody for being here.
Thank you.